Modern medicine and research tools have brought about an opportunity for medical professionals to reassess their conception of ADHD and other attention deficit disorders, who they affect, and which ways are common for the symptoms to be portrayed. It's estimated that 5% of children and roughly 2% of adults have been diagnosed with ADHD or a similar disorder in the United States. Modern research is showing that though traditionally thought of as an adolescent disorder, ADHD is also typical in adults. It's just portrayed in different characteristics, meaning that many adults have been overlooked or even misdiagnosed with other sorts of mental disorders. These overlooks or misdiagnoses are a consequence of a fixed perspective that limited ADHD solely to the hyperactive impulse type, not the inattentive type. While the hyperactive type displays the classic symptoms of ADHD, jumping on couches, impulse control, or an inattentive type ADHD person is internally distracted from their thoughts and does not have hyperactive traits that would lead one to assume that they had ADHD from a traditional symptom standpoint. Of those living with ADHD, adult women are particularly affected. Leading psychotherapists theorize that the reason why most adult women suffer from ADHD undiagnosed is because in children with ADHD, women generally portray symptoms in an inattentive type manner, while men portray them in a hyperactive manner. Oftentimes, these women suffer silently, and they describe their lives as always feeling overwhelmed or frequently playing catch-up. Most clinicians find a strong correlation between these untreated individuals and coexisting conditions such as eating disorders, sleep deprivation, a tendency towards alcohol or drug abuse, and a variety of mood disorders like major depression or anxiety. While equally as likely as their male counterparts to suffer from ADHD, most clinicians theorize that women are inclined to have the inattentive type. Consequently, they could be less likely to act out or portray symptoms that would lead doctors to diagnose them in a young age. Of the adults diagnosed with ADHD, only 5% of them actually portray external symptoms, which would be considered hyperactive behavior. For the others, they are focused more towards a trait called hyperarousal, which oftentimes leads to the misdiagnosis of other mental health conditions, such as bipolar or a mood disorder. This hyperarousal, in the most simplest of terms, makes these individuals more susceptible to feeling their emotions and their chemical ups and downs, making them capable of experiencing not only the lowest lows, but the highest highs. Although previously viewed as an adolescent behavioral problem, it has become clear that ADD and ADHD are actually complex adult behaviors that have so much research to be explored, and that medical professionals and psychologists have only touched the tip of the iceberg in understanding the complexities of the human brain composition and our behaviors that act out of it.